Good morning, friends. Let me speak on A to Z uses of beta blockers. This is a WhatsApp CM. What are beta blockers? Beta blockers are drugs acting on adrenergic receptors. They can be either alpha adrenergic blockers or beta adrenergic blockers. Alpha adrenergic blockers act on alpha 1, alpha 2, and both alpha 1 and alpha 2. Beta adrenergic blockers act on beta 1, beta 2, both beta 1 and beta 2. Beta blockers inhibit adrenergic response mediated by beta receptor. Beta blockers can either be cardioselective or non-cardioselective. Cardioselective beta blockers act on beta 1 receptors. Non-cardioselective beta blockers act on beta 1 and beta 2. Cardioselective beta blockers can either be intrinsic sympathomimetic activity, namely celiprolol, and non-intrinsic sympathomimetic activity, namely atenolol, bisoprolol, metoprolol, esmolol, which is a short-acting beta blocker, nebivolol, which is vasodilatory, acting on L-arginine nitric oxide pathway, which is very advantageous for hypertension, creating vasodilatation. The non-cardioselective beta blockers act on beta 1 and beta 2, that is with intrinsosympathetic mimetic activity, that is pindolol, oxprenolol, and penbutalol. Non-ISA, that is non-intrinsic sympathomimetic activity, that is propranolol, which we commonly use for many conditions, namely anxiety, migraine, portal hypertension, nadolol, timolol, sotalol, corvitinol, that is alpha blocking property. Let us see how beta blockers act. They are blockers of catecholamine release. So, it increases VF threshold and it can reduce heart rate and blood pressure. It reduces myocardial contractility, which in turn reduces oxygen requirement by myocardium, resulting in reduction of ischemia. It also reduces early morning platelet aggregation. It reduces ejection velocity, in turn reduces the force, block rupture is reduced, resulting in reduction of coronary thrombosis. Finally, the myocardial infarction, early morning sudden death can be prevented. So again, the catecholamine surge may aggravate, that is in turn prevented by beta blockers. Let us see the distribution of beta receptors. The beta 1 is to beta 2. The ratio distribution in cardiac muscle. The beta 1 will be 2/3 and beta 2 will be 1/3. Let us see what is upregulation of a receptor. Beta 1 receptor density is reduced in heart failure. Chronic blockade of beta receptors by blockers, that is number of beta 2 blocker density is increased. So long-term use will improve heart failure, that is systolic function. A combination therapy will be complementary and cardioprotective. The complementary drugs are diuretics, calcium channel blockers, alpha blockers, ACE inhibitors, and angiotensin receptor blockers. What are lipophilic beta blockers? Lipophilic beta blockers, they cross blood-brain barrier, so they are said to prevent sudden cardiac death. One is bisoprolol, another is metoprolol. And all drugs have got metabolism, that is either through liver or through kidney. The first pass metabolism, all of us know, it is through liver. The second pass will be kidney. So some drugs will have a dual pathway. The first and foremost dual pathway is bisoprolol, that is 50% liver and 50% kidney. The metoprolol will escape liver, but it passes through kidney, that is second pass metabolism. The atenolol will have a first pass metabolism, that is passed through liver. Let us see the cardiac action potential. So there are phases of cardiac action potential, the corresponding ionic events. So there is an intracellular membrane, there is extracellular sodium ions, calcium ions, and intracellular potassium ions. So there is exchange of ionic events, so that results a depolarization, overshoot, plateau, repolarization, resulting finally in diastole. The movement of ions across the cell membrane is to produce the action potentials. That is, sodium, all of us know, it is extracellular, potassium is intracellular. There is an exchange of sodium, calcium versus potassium ions. They result in depolarization and repolarization. So what is the mechanism of action of antiarrhythmics? So class 1 is sodium blockers, class 2 beta blockers, it is depicted in this slide, and the class 3 is potassium blockers, and class 4 is calcium blockers. Let us have a look at morsel of beta blockers. Just remember beta blockers is an easy way of remembering the action of beta blockers. What is B? Beta adrenoceptors blocking. E, effective in lowering blood pressure. T, to treat cardiac and non-cardiac conditions. A, adverse effects, keep it in mind. B, beta blockers, cardioselective, non-cardioselective, intrinsic sympathomimetic activity with membrane stabilizing or without membrane stabilizing activity. L, lipophilic, liver metabolism, first pass, non-lipophilic. O, oxygen requirement reduction. C, catecholaminase block. K, potassium hypokalemia prevention. And mostly the potassium, the hypokalemia is prevented. The ideal is non-cardioselective beta blocker, that is propranolol, because the potassium, the cell membrane, is beta 2 mediated. E, ejection velocity reduction or rate of heart reduction, renal metabolism, that is second pass. S, the stabilized block, prevent rupture. Beta blockers continue to surprise us, so said J.M. Cruikshank. Yes, beta blockers are continuing to surprise us. Just remember the alphabets A to Z. We can very easily remember the properties of beta blockers. A, anxiety, arrhythmias. B, blocks beta receptors. C, coronary artery disease. D, dissecting aneurysm, Marfan syndrome. E, essential tremor. F, phallostatology. G, glaucoma. H, hypertension. It can be systemic. Portal, it can be used hyperhidrosis, excessive sweating, especially thyrotoxicosis. I, insulinoma. J, juxtaglomerular hyperplasia, that is Barter's syndrome. K, potassium low. L, LV dysfunction. M, migraine prophylaxis, mitral stenosis. N, narcolepsy. Let us continue the surprise. O, for obstructive sleep apnea. P, prolapse of mitral valve, pheochromocytoma, postural orthostatic tachycardia syndrome, perioperative. Q, for QT interval prolongation or regurgitation of mitral valve. S, subarachnoid hemorrhage. T, thyrotoxicosis, theophylline overdose. U, unstable angina, vasovagal attack. W, withdrawal of alcohol. X, that is syndrome X. Y, beta blockers yield cardiac non-cardiac actions, of course, Z zestfully they yield. Let us go through nebivolol. Again, just remember the alphabets nebivolol. N for nitric oxide release modulator. E for endothelial dysfunction reversal. Because there is always a vascular endothelial dysfunction with systemic hypertension. Nebivolol influences L-arginine nitric oxide pathway, as we have already told. B for beta 1 selectivity, BP reduction. I for intrinsic sympathomimetic activity through beta 2, beta 3 receptors. V for vasodilatory. O obstruction of airflow not impaired. L liver metabolism. O oral and OD dose sync. L for lipophilic. Let us see mnemonics for bisoprolol. B for BP reduction. I inhibits beta 1 receptors. S systolic dysfunction, congestive heart failure, right ventricle and left ventricular dysfunction, stable angina improvement. O oral. P for plaque stabilization or renal metabolism half. O OD dose single. L liver metabolism half. So bisoprolol has a dual metabolic pathways. O obstruction of airways not affected, low affinity to beta 2. L lipophilic, lipid profile, no adverse effects. Let us also see A to Z indications of beta blockers by famous personalities wise, so that we can very easily remember the A to Z indications of beta blockers. Let us start with the great former, late Honorable President Dr. Abdul Kalam. So remember him, A for arrhythmias. Let us go to other aspects of beta blockers. B. Bretley, famous cricketer. B. Blocks beta receptors. C. Charlie Chaplin. C for coronary artery disease. D. Donald Bradman, again another famous cricketer. D for dissecting aneurysm, Marfan syndrome. Then Thomas Alva Edison, a famous scientist. E. Essential tremor. Let us see the other indications of beta blockers. F for Fowler's tetralogy, Andrew Flintoff, a famous cricketer. G for glaucoma, we can remember the famous Sikh Guru, Guru Nanak. H for hypertension, Harini, famous chess player, and former late Honorable Prime Minister Indira Gandhi. I for insulinoma. J for juxtaglomerular hyperplasia, that is Waters syndrome, the famous James Bond. K, that is Kamal Hassan, famous Tamil artist, the famous artist of Big Boss. And K for potassium low. L, the great leader, L.K. Advani, L, LV dysfunction. And M for Mahatma Gandhi, the patriot. The M for migraine prophylaxis, mitral stenosis. N, Navajit Sidhu, famous cricketer. N for narcolepsy. O, obstructive cardiomyopathy, Urvasi, famous Tamil artist. Another artist, P. Priyanka Chopra. P for prolapse of mitral valve, perioperative. And the Queen Elizabeth's Q, that is QT interval prolongation. R for Rahul Dravid, famous cricketer, or regurgitation of mitral valve. Yes, the famous patriot Subhash Chandra Bose. Yes for subarachnoid hemorrhage. Again T for Tendulkar, that is thyrotoxicosis. All of us know Tendulkar is a famous cricketer. U for unstable angina, We can remember it by remembering Unnikishan, a famous singer. V, we can remember Virendra Sehwag, a famous cricketer. V for vasovagal attack. W, Wasim Akram, another famous cricketer. That is W for withdrawal of alcohol. X, syndrome X. Y, yield cardiac and non-cardiac actions. We can remember Yuvraj Singh. Z, Zahir, that is Z, zestfully Zahir, all of us know, a famous cricketer. We have analyzed A to Z uses of beta blockers, and also I have paved the way of remembering the actions of beta blockers from A to Z. Thank you all for patience hearing.